Middlesex Elderly Assessment of Mental State (MEAMS) was designed by Evelyn Golding in United Kingdom 1989.
Objective of the Middlesex Elderly Assessment of Mental State. The Middlesex Elderly Assessment of Mental State was developed as a screening test to detect gross impairment of specific cognitive skills in the elderly. It has been designed to assist clinical psychologists, psychiatrists, doctors, occupational therapists, speech therapists, and others who work with the elderly to differentiate between functional illnesses and organically based cognitive impairment.
The purpose of this assessment is to detect impairment of cognitive skills in the elderly population. It allows practitioners to differentiate between cognitive impairment and physical dysfunction. It takes 10 to 20 minutes to complete the assessment. The target population of this assessment is elderly people. The materials contained inside the bag is one manual, two stimulus books, and scoring sheets. There are 12 subtests in the assessment, which are 1. Orientation 2. Name learning 3. Naming 4. Comprehension 5. Remembering pictures 6. Arithmetic 7. Spatial construction 8. Fragmented later perception 9. Unusual views 10. Usual views 11. Verbal fluency and 12. Motor perseveration. The method of administration is: first, examiner can choose either version A or version B to assess the patient for the first evaluation. Then, examiner should use different version for the reassessment. Next, examiner should only use the instruction given in the administration manual booklet on the patient. Lastly, fill in the score in the scoring sheet given and interpret the score to detect which part of cognitive function patient might have problem. For scoring interpretation, if pass, the score is 1. If fail, the score is 0. Maximum possible score is 12. Total score of 10 to 12 indicates that patients are considered to be performing within normal limits. Total score of 8 to 9 are borderline, and patients should be examined more closely. For total score below 8, patients should receive more testing and investigation regarding their cognitive functioning and skills.
Validity of the Middlesex Elderly Assessment of Mental State. First is convergent validity, which fall under the category of construct validity. The internal construct validity was good by feed of the data to the RASH model with the mean item fit negative 0.178 and the standard deviation of 1.019. Item was substantially free of differential item functioning. The external construct validity was confirmed by expected association with physical and cognitive disability. The effect size was 0.42 compared with 0.22 for cognitive functional independence measure. Validity was examined by correlating the Middlesex Elderly Assessment of Mental State with established tests such as the Mini Mental State Examination with the correlation coefficient or R value of 0.64, clock completion test with R value of negative 0.53, and functional independence measure with correlation coefficient value of 0.35. Next, content validity. Middlesex Elderly Assessment of Mental State was developed by Evelyn Golding in 1989. For its criteria validity, which is concurrent validity, Middlesex Adderley Assessment of Mental State has adequate to excellent concurrent validity with mini mental state examination and clock drawing tests which tested to hospitalized elderly. It also has adequate concurrent validity with functional independence measure while tested with hospitalized elderly who acquired brain injury. Reliability of the Middlesex Adderley Assessment of Mental State. Reliability was found to be good with Cromba alpha of 0.82 at both admission and discharge, and likewise an intra-class correlation coefficient or ICC of 0.80. Person separation index was 0.813. For inter-rater reliability, 22 patients scored separately but simultaneously by 2 raters. 4 different raters were used, include 3 psychologists and 1 social worker. Correlation was 0.98, which indicate a very high inter-rater reliability. Next, for parallel form reliability, 2 versions of Middlesex Adderley Assessment of Mental State were used to allow for reassessment. Both versions were given to the total of 28 subjects, and the number of subtests failed was recorded. Correlation between the two forms of tests was highly significant at 0.91. Sensitivity of the Middlesex Adderley Assessment of Mental States. The Middlesex Adderley Assessment of Mental State was found to be more sensitive in detecting mild cognitive impairment, and it also sensitive to the presence of focal brain lesion compared to mini mental state examination.
Item 1 is orientation. This subtest comprises a number of questions designed to find out whether the subject is oriented in space and time. They are subject name, age, date of birth, current date, and location. Each item is scored 1 and the pass score is 5.
Hello, good evening.
Good evening.
Okay, my name is Aiman. Today I'm your occupational therapist.
Okay.
And today I'm going to conduct an assessment called the Middlesex Adderley Assessment of Mental State. Okay, this assessment is used to detect gross impairment of specific cognitive skill. All right, and this assessment will be conduct about 10 to 20 minutes. And I hope you will give the cooperation along the conducting the assessment, and all the information is confidential. All right. Okay, I'm going to ask you several questions, and you must answer according to the questions. All right. Okay. What is your name?
Mr. Hadi,
All right. What is your age?
73,
Right. What is your date of birth?
8 November 1957.
Okay. What is the date today?
4 February 2016.
What is your address?
Don't know.
For item number 2, the name learning, the subject is asked to repeat and remember the name, and the recall is tested later. Each correct item is scored 1 and the pass score is 2.
I'd like you to try to remember this person's name. Her name is Marty Carter. Can you repeat her name so I know you have heard it properly?
Marty Carter.
Okay, in a few minutes, I'm going to ask you what her name is. Alright?
Item 3 is naming. This brief test of language ability requires the subject to name a watch, its strap and the buckle or clasps on the strap. Each correct item is scored 1. The pass score is 3.
What is this?
Watch. Okay. Strap. Buckle.
Alright.
Item 4. Comprehension. This requires the subject to name 3 items from 3 verbal descriptions. Each correct item is scored 1 and the pass score is 3.
Okay, I'm going to describe an object. Can you tell me what it is? Okay. What is the name for a glass or polished surface that you can look in and see a reflection of yourself?
Glass.
Right. What is the name of the hard outer case that protects animals like tortoise and snail?
Shell.
Right. What do broadcasters speak into so that they can be heard easily?
I don't know.
Item number 5. Remembering picture. This requires the patient to memorize the picture that will be shown to him. Every picture that is correctly identified by the patient will be scored 1 and the pass score is 8.
Okay, now I'm going to show you some pictures, one at a time, right? Later on, I'll show you some more pictures. Some of them will be ones I have already shown you. Others will be new ones, right? I will ask you to pick out those you have already seen. Okay, I'll show you each picture for several seconds to give you a chance to remember it. Right? Okay, we move to the first picture. Okay, here is the first picture. Can you tell me what it is?
Cockroach.
What is this?
Chicken. Finger.
And this?
Nose.
And this?
Spoon.
Item 6. Arithmetic. This requires the subject to perform 2 simple addition and subtraction. Each correct item is 1. The pass score is 3.
I'm going to ask you to do some sums.
Okay.
Okay, can you tell me the answers?
Yes.
Alright, we move to the first question. 6 plus 4.
9.
7 plus 5.
12.
9 minus 4.
5.
For item number 7, spatial construction, the subject is asked first to draw a square and then to copy a 4-pointed star. And each correct item is scored 1 and the pass score is 2.
Will you draw me a square on this piece of paper, please? Right. Okay. Okay, can you copy this? Now we are going to return to the pictures of objects. This time, for each picture, I'd like you to say yes if you saw it a few minutes ago, and no if you didn't.
Okay.
Okay? Now?
No. No. Yes. 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 Yes.
Item number 8, fragmental letter perception. This tests the subject ability to perceive in complete form. The subject required to name a series of letters, one which is eligibly and solidly printed and the other three in fragmented form. The subject failed this test if she or he made more than one error. If the patient have speech difficulty, she or he can write it rather than name it. The pass score is 3.
Okay, what is this letter?
T.
Okay, this is a letter of the alphabet, but it is not complete. Can you tell me what the letter is?
M.
This is another letter of the alphabet, but it is not complete. Can you tell me what it is?
K.
This is another letter of the alphabet, but it is not complete. Can you tell me what it is?
B.
Item 9. Unusual views. This comprises a series of photograph object from an unusual angle. The subject task is to identify the objects by naming it, or if he or she has naming difficulties, indicating correct identification of the object by miming or describing its use. A subject must identify 2 of the 3 items to pass the subtest. If the subject fails on any of the 3 unusual views, then proceed with subtest 10, which comprises object photograph from a more conventional viewpoint.
What is this?
Screwdriver.
What is this?
Cellophane tape.
What is this?
Needle.
Item 10. Usual views. Once again, the subject is required to identify the objects, naming, or otherwise indicating an understanding of the object depicted. The ability to identify objects from a usual viewpoint but not from an unusual viewpoint indicates that the problem is one of perception rather than sensory deficit or naming disorder. The pass score is 3.
What is this?
Screwdriver.
What is this?
Tissue.
What is this?
Needle.
Item number 11. Verbal fluency. This task involves asking the subject to think as many animals as possible within 2 minutes. A normal subject will be expected to think at least 10 animals in this time, whereas subjects with damage to the frontal lobe often have difficulty with this kind of test despite having apparently normal language. Pass score is 10.
When I say start, I want you to tell me as many animals as you can. I will tell you when to stop. Okay, now start.
Cat. Fish.
Stop.
Number 12. Motor perseveration. This is another task which tests the executive capacity of the frontal lobes. The subject is instructed that when I tap once, you tap twice. When I tap twice, you tap once. The subject is given 3 practice runs which can be corrected if he or she makes an error. 5 uncorrected runs are then carried out. Pass score for this item is 3.
I am going to give you a rule. When I tap once, you tap twice. And when I tap twice, you tap once. Okay? Okay, we try it first. Okay, now we begin. Can you remember this person's name?
Mary Jane.
Okay, the second name began with C. Can you remember the name now?
Mary. No.
Now we finish. Thank you for your cooperation.